And welcome everybody. Thanks for joining us tonight, and thank you for watching this very important webinar on what's going on with your health. So the primary topic is stress and hormones and health and how it's affecting you. So would you agree with me that we're having a healthcare crisis in our country? And would you also agree with me that we're having a crisis in health? And so if you say, okay, well, what's the cause? Why are we having such a big crisis? If you look at the information that we receive today, if you look at when we started, recording history, basically written history, to 2003, now that same amount of information is duplicated every 2 days, every 48 hours. You're getting that much information thrown at you. The problem in our healthcare system, and the problem with healthcare, is a lot of it is misinformation. So we're getting information that's not really helpful. In fact, a lot of the information can do more harm than good. If you look, for example, at the #1 disease in our country, it's heart disease. Heart disease kills about 611,000 people every year. And so many of those deaths could be prevented if we got the proper information. So if you go on the CDC's website, the Centers of Disease Control, you look at what their #1 recommendations are to prevent heart disease, and the first recommendation is stay on the medications your doctor's prescribed. Even though a lot of those heart medications, science has proven time and time again that they may not be helpful, especially when you look at statins. Second recommendation they have is to eat a diet low in fat and low in sodium. And your heart needs sodium to function. Your body also needs good, healthy fats to function. So, it may not be the best information. The third recommendation, which I completely agree with, is get up and move more. Every 5 minutes you want to be, or every five days a week, you want to get up 3 times a day and walk for about 10 minutes. Do some brisk activity. So why all the misinformation? One of the biggest causes is money. So one of the biggest motivators out there is pharmaceutical companies. It is a billion-dollar industry. The medical industry is a trillion-dollar industry. We spent over $3 trillion in healthcare last year. So we spent more than any other industrialized country, yet we rank one of the lowest. We're 48th out of all the countries, 160 countries in the world. We rank 48th in life expectancy. Infant mortality, we're one of the worst. We are one of the worst as far as iatrogenic causes of death in our country. About 225,000 deaths are attributed to Western medicine, conventional treatments. So here's a study by the British Journal of Medicine, the British Medical Journal. 85% of all medical procedures and surgery are scientifically unproven. And then to make matters worse, 90% of all diseases prevalent today are not treatable with orthodox medical procedures. That's the World Health Organization. So what do we need to do? We've got a system that's broken. We have so many talented doctors, so many talented healthcare providers who care about you, but they've been fed misinformation from the beginning. They're trained to treat acute diseases with a medicine that is heroic. If you have a broken arm or if you have a heart attack, this is not the right clinic for you. This is not the place you should come. I'm not going to come here if I have a broken arm or a heart attack. I'm going to go get it fixed at a hospital. And that's where the medicine really shines. Where the medicine doesn't shine is in chronic conditions. And 85% of our healthcare spending is used to treat chronic conditions. But as we've seen, our treatments are not working. So who am I? I'm not an allopathic doctor. I'm not here to replace your doctor by any means. I'm here as a messenger. So being here as a messenger, don't get mad at me. I'm just trying to give you the facts. I am a wellness provider. I'm trained in functional medicine. I'm trained in traditional Chinese medicine. I'm also trained in acupuncture. But one of my major purposes is getting out information to the public that can help empower you to change your life. So today, all I ask is that you give us a chance. All I ask is you look at this information, you see if it resonates with you, because if it does, then you can really make a shift in your life. We know knowledge is power. We've all heard of that. but really it's applied knowledge that becomes power. Otherwise, it's just knowledge, it's just information, and we know there's plenty of information out there. So tonight we're going to talk to you about some very important things. In our health crisis, the wrong and lacking information, sometimes we've been taught that there's a shortcut. Our goal is not to give you a shortcut, it's to give you a long-term health plan to help you become proactive. Because if you're not being proactive, you may look like this person taking their dog on a walk. Some of my patients have to get very specific as far as what they're doing with activity, but as you can see, that's not what we want you doing. We want you looking at, what's causing negative stress in your life. There's physical traumas that built up. If you played football, if you've been in a car accident, if you've had on-the-job injuries, those are negative stressors. We have chemical toxicity in our environment. Over 82,000 chemicals are in our environment that we're exposed to on a daily basis. If you go in the Salt Lake Valley and breathe the air during an inversion, that is incredibly toxic for your system. They've actually looked at heart rate incidences in Beijing when they turned off the factories for the Olympics. The heart rates shut down. Heart attacks, it shut down. Once they turned the factories back on, heart attack levels just started creeping up again. So it affects the mitochondria in the heart. We want to talk to you about that. We also want to help give you information about how to handle emotional stress. We've all got it. If you've got a relationship in your life, or even if you've got a brain between your ears, which I know all of you do, you're going to have some emotional stress. So we look at food. One of the major things is we believe in providing a curriculum, a program. So our approach is different in that we take a team approach. So we use holistic information. We also use knowledge from Western medicine, some of the latest research, some of the most promising labs. We go through those with you. So one thing we want to do is create a curriculum that focuses on the 5 pillars of health. First thing we got to do is get your body detoxed. We all are walking around with too many toxins in our bodies. Second thing we want to talk about is gut health. I mean, you think of how many people, especially in Utah, have depression. We are the state that uses the most antidepressants per capita. And that's not okay. I mean, I've never met somebody who's Prozac deficient. Now, there's a time where you may need to use those medications, but our goal is let's get your body functioning as well as we can. Let's work with your doctor and maybe seeing which of these medications you can thrive without. So we've got to look at detoxification. We also got to look at nutrition. Food is one of the definite pillars. What you put into your mouth, that literally you are what you eat. And there's so much misinformation. I mean, you watch Dr. Oz and he's always got something new coming up. So we want to give you the truth about nutrition, and the hint is it's always individualized. So it's based on what your body needs, where your imbalances are, where your micronutrient deficiencies are. Then we correct the nutrition by giving you the right diet, the right plan. But we want to make it simple. Another one of the pillars is going to be fitness. We want you to exercise. We don't just mean fitness like get out and run, because running may actually do more harm than good for you. It may be great for me, but somebody else may need more high-intensity interval training. Somebody else, we want you to do weightlifting. So there's ways that we can help teach you to put on muscle, because if you have some stubborn belly fat, or maybe you have a thyroid issue or an adrenal issue, we want to address those appropriately for your case. So in a lot of times, if you're not exercising in an appropriate way, you can actually do more harm than good. Exercise is medicine. So we want to put the program together that helps you understand how to exercise. We also want to look at your labs. We believe in looking at the function of the body. So if we can look at the labs and understand where your body may be, even if it shows it within normal range, if it's low normal, a lot of times labs aren't going to pick things up. So we want to look at things just a little bit differently. So we train you on how to understand and read your own labs. We also want to look at the 5th pillar, which is going to be looking at your mindset. How can you learn how to breathe better? How can we'll train you on how to do some simple visualizations, some simple meditations, and teach you how to be more connected in your relationships. We believe family is incredibly important. We believe your relationships are incredibly important. We believe your relationship with work is incredibly important too. So we teach you ways of how to have a better work environment, how to be more peaceful at work, how to handle the stress when your boss gives you yet another job. So we put together a curriculum that's holistic based, that's really going to help. We also have services. We have medical services that are natural based. We have treatments like stem cell therapy, trigger point therapy. We have a headache protocol that's very simple, and it gets rid of the symptoms so that we can get your body into more of a healing mode. So if you look at taking this information, where you are today, we want to look into the future, and where 2-3 years from now, you're a whole new person, because every cell in our body is constantly changing, it's constantly regenerating. So the more that you can put positive stimulus, positive stress on your body, you'll move in a direction that will actually help promote your optimal function. Because that's our goal. Our goal is not just to treat your symptoms, but our goal is to treat your function so that you're actually functioning as well as you can. A good definition of function is the ability to perform an action. So if you look at the actions you're not able to perform because of your health, it can be pretty frustrating. If you can't hang out with your family, if you can't pick up your grandkids, if you're unable to go on that ski trip because your function's down, we want to help enhance that. Symptoms are that's the last thing to show up. If you just focus on symptoms, that would be like taking your car to the shop, and the mechanic, what he does is he looks at that check engine light and removes the fuse, turns off the check engine light, gives you your car back. You'd be furious. But yet that's how the medicine is being practiced in our society today. We've got to get away from the symptom-based approach where it's just one pill solves one problem. And then that one pill becomes 2, then it becomes 3. Where the average person over 65 is on 8 medications. So it's a cascade effect. What we want to do is get to the root cause. Not just look at the check engine light, but actually lift up the hood. Look underneath everything. So when you come to your first visit, we're going to take some time. We're going to take a full hour, and we're going to sit down. We want to review your labs. If you have any labs, bring them. Have your doctor's office, send them over. Or we're happy to call your doctor's office as well. We want you to bring those with you. We want you to bring your spouse, because we're looking at lifestyle change. You can't do this on your own. So bring your spouse, bring your loved one, because we need to get the whole team involved. It takes a community. We've got amazing healthcare providers here at East West that are going to help you, see you through every step of the way. So we have people who are going to help you with understanding nutrition, understanding labs. We're going to give you detailed instructions on how to detox. We're going to put a program that's comprehensive for you, but one that you feel good about. We don't want to move forward with anybody until they feel like this is the right fit for them. These are tools that I've learned. These are things that have helped me stay healthy and vital. And so we want to share these with you. So thank you so much. Please go onto our website. What you want to do is just learn a little bit more about us, what we do. We'll have new patient paperwork coming your way. So you want to look for that. And then, like I said, plan on spending an hour with us. This could be one of the most valuable hours you've ever spent with a medical practitioner. So thank you very much, and have a great evening.